In today's episode, I'm joined by three of my students from the Birth Healing Intensive program. These students are going through the 9-month program, and they joined it wanting to learn how to get better results and build confidence and trust in their skills. What they got out of the program far exceeded their expectations and took them to a whole new level, both personally and professionally. Listen in as they share their experience in doing their own inner work through this program and the impact this work has had with their clients. Stay tuned to the end as they share some incredible case studies with us. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. I am super excited to introduce you to these amazing therapists here. We have Lori Badish, who is in North Carolina. Everybody's a physical therapist here. So we have Melissa Reitman, who, did I say that correctly? Reitman? Reitman. Okay. Reitman. Melissa is in Colorado with me. She's just on the other side of the mountains. And then we have Nancy Brandberg, who is in Virginia. So we got the East Coast and we got Colorado covered here. So thank you guys for joining me in this podcast. And all three of these practitioners have been a part of this year's 9-month program of the Birth Healing Intensive. And we just wanted to share. I wanted to ask them some questions and have them share about their experiences of being a part of this program and how this program has actually impacted their practice. And maybe we'll share a couple of case studies or talk about how they've been able to implement this work into their practice. So first, I'll welcome everybody. Thanks so much for being here.
Thanks for having us.
Yes. So I would love to know, to start this off, is what made you guys want to take part in this birth healing intensive? Were there any struggles or challenges that you were having that made you say, this is what I need to do? Lori, do you want to start off?
Yeah, sure. So I became involved in the birth healing coursework, and that led me into the intensive, just hearing more and more of the stories about how much more we can learn about the person's body, how we can integrate the physical and the emotional pieces together. So hearing the little pieces and snippets in the coursework it kind of attracted me to the intensive. But the struggles I was facing was, I don't have enough tools. There's something I'm missing. This person's having trauma. I'm finding myself feeling traumatized, trying to work with this traumatic thing and feeling emotions that this person has about their miscarriage or their C-section that was horrible. I was starting to feel angst in my own self. I was like, I can't. Ugh. And I was starting that funny face when you have a trauma patient come in like, ugh.
Yeah.
So I felt like I needed to get the face off and try something else. And some of the comments through the coursework was leading me to believe that there was more I could do.
Got it.
And that was my first
Cool.
desire for taking a challenge.
Awesome. Melissa, what about you?
Yeah, I think in some senses, this was like my first test in following my intuition, because I had taken several courses from you in the past. And when I saw it, I just knew I was supposed to take it without really knowing why. And then the more I looked into it, it was like, yeah, I've learned all these techniques. I've always felt like I was a little bit different of a PT. Like I would do things different in the clinic than those people who are really up on their ortho skills. And I just had this sense, just from having worked with you and taking courses from you, knowing I'm like, she does things the way I already do things. Like I just resonated so much. And so I knew that this was going to give me even more valuable information and knowledge about how to use the very technical skills that you had already taught me. But I just knew there was this whole other layer that I could kind of see in your courses that I was really excited to be a part of.
Yeah, awesome. How about you, Nancy?
I think I have to echo both Lori and Melissa on this one. I think they've answered that question really well for me too. I I honestly resisted working with immediate postpartum moms for a while. Only a lot of it was because I had my own birth trauma.
Ah,
And I was also farther along the journey into perimenopause and menopause, and so I was concentrating on that population, and then I was like, "Huh, this person called Lynn keeps showing up in my life." So I did, the postpartum mom course with you last fall, and everything just clicked, and my ability to work with the immediate postpartum mom just I don't know, it really changed how I practiced and how I looked at that particular population of women, and so when you offered the intensive course, I was like, "Yeah, I gotta take that." Just I'm just
So
gonna I'm just gonna keep going.
so kind of like Melissa, it was just kind of this knowingness that you needed to, yeah, awesome. That's so cool.
Yeah,
I am a knower too, guys. So in the Birth Healing Intensive, we talk about our intuitive ways we get that intuitive information, and knowingness is one of those. It's like you don't know why you know or how you know, but you just know. You got to know, and you got to do it this way. So I when someone told me I was a knower, I was like, what's that mean? There's also people see things. Sometimes they'll see things in their inner mind, or they might hear things. And then there's knowers. And knowing is actually a very strong intuitive skill. But over the years, and I don't know if you guys have the same, but my vision is probably the weakest, but I've been hearing more and more. So the other aspects of my intuition, they're coming in different ways too. So um, and that's one of the things we work on. Have you guys noticed anything changing since that? Since being in, yeah, what would you?
Yeah, I mean, if I can say it was very much validation because I had this thing that I didn't quite know was a thing and didn't know
Right?
how to use it or hone it in. And so in a sense, a lot of this course has validated for me things that I have experienced but didn't know. There was no PT course that taught me how to use it and where to put it. And I think too, I mean, in my life, I think I could say women in general, but just in my life, intuition was not something that was fostered in me.
Right.
And so when you described the different types, the knower, the seer, the hearer, I was like, oh my gosh, that's a thing. That's like when you read something that you're experiencing and you realize I'm not alone.
Yeah.
I'm not a
Yeah.
weirdo, and I can use this for
Yes.
benefit.
Yes. Yeah. So in your sessions, it's just like it happened to me today. I just saw the position that the person needed to be in. Like I just knew that that's what needed to happen. And so when you can trust that and just go with it, I
Mhm.
don't know what's your experience, Nancy, when you follow that intuition, what are your results?
yeah, very much the same. It's my I think what I've come to learn in doing this work, especially this past year, is really ha- I have more language now to explain or to put into words what I've been doing for my whole career, I think. And I had pieces of it, but I didn't have a language. So I did John Barnes work back in the 1980s when it was like everybody was like, "Oh my God, PTs!" And I came to Washington. We met, with the APTA trying to get recognized. So I've been doing the work for a long time, but didn't have a language. And so this, again, the validation, but also going, oh, yeah, this is what I do. And it's okay that I'm a different kind of PT. I'm happy to be that different kind of PT
Yeah.
that I don't, when somebody today, and again, people ask me, well, what muscle is that? And sometimes I have to stop and go, oh, well, that's the such and such muscle because or what ligament are you on now? And I'm like, oh, because I don't even think in that language.
Right. Right. Yeah. Because you're just following the body,
I'm
right?
just following the body.
You're following the tissue. And sometimes you don't even know what tissue you're on, but you're working in that general area and you feel the release.
Yeah.
And I don't know about you all, but I am addicted to the release.
Yeah,
Mhm.
a big struggle for me used to be as because I was feeling it so much, and I have had this ability to know, like, I could go into I could find the position really quickly, but then I had to back way off to allow the women on my table to come to that point.
Mm.
So I think until this course really, I have my sessions are way different. I hardly talk at all now anymore, whereas before I used to tell them everything that I was experiencing for them. And
Ah.
so I think the healing that women are experiencing since I've been doing this course is way more deep or deeper than what it was before.
Oh, that's so cool. That is
Mhm.
so cool. Yay. All right. So, Lori, what were you hoping to get out of this course when you signed up for it?
So I work in a very busy hospital-based outpatient pelvic health clinic, and I've been the manager there for many, many years. So to be honest with you, I really need to find something that worked fast and
Ah,
something that I could start having impact that day, because it may be several weeks before they can get back to see me. It may be that they wouldn't come back if I didn't make an impact that first day. I have had poor compliance. I had issues along the logistical line of getting my patients in. So that was kind of a first thought, like if I can, because I was seeing good results from the postpartum and the pregnancy course, that this is quick. So if I can get better at this, then I can get people in faster, get more patients in, get my patients seen. I have a 3-month wait list. So it just was a logistical hope that I can be better faster. And
and
then it turned into all the things that they're talking about. So
right.
that was my initial hope.
And did it happen?
Oh yeah. Yeah. Well, I think I'm starting to see a difference that people aren't necessarily coming back as often, because I'm following up with them in my chart, and asking them, and they say, yeah, everything's going great. I'll see you whenever. So
Yeah.
I'm canceling my appointments because I'm not better. I'm not needing to come back because I feel like this is helping me. So I'm
Mhm.
getting a lot of those, and I've done on those, like the my chart follow-ups like a week or so later, just to make sure things are going well. But that was my big hope, and the goal was, like I said, fewer treatments, higher outcome measures for our data.
That,
um,
that's
and
awesome.
and then again, then it turned into, oh well, maybe I could be a better person overall.
Oh, tell me more about that.
So that was one of the thoughts going into it, was like, oh, I need to do work. I'm the PT. I exercise, I stretch, I do yoga, I eat well, I feel good, asleep. I'm good. You need work. I have to help you. I have to help you. And then it came to my understanding that, oh, I need to do work too. So I was like, okay, well, I had birth trauma and I don't have patience, and I'm quick to judge things. So that was a big eye-opening revelation to me, that I have a lot more work to do than I ever thought I needed to know I had to do.
And what have you noticed on the work that you've done on yourself through this program?
I talk slower. I listen more. I sit in my chair, grounded. And when I get stuck, I don't panic.
Ah, wow. That must be different.
Oh, yes, because I'm a very energetic, high intensity person. I'm just sitting here relaxing, not even talk with my hands very much now, which is amazing. So a lot of times you'll find patients or clinical experiences where you're just like, this isn't making sense. This isn't making sense. And I used to, you know, walk around the room and pace around the room and what do I do? What am I missing? And now I just sit there and I just take a breath and I say, let's figure this out. Let's breathe. Let's get curious. Let's try something else. And my bag of tricks is so much deeper that
Mm,
I don't feel panic. I don't feel angst as much as I used to.
wow.
And that makes me have fun. That makes me come home happy. That makes my husband happier, because I'm not coming home like, rah. I leave my patient's trauma in the room. I don't take it home with me anymore. I don't wake up at night wondering how that person's going to get through the night when their pain is so bad. I don't do that anymore.
Oh my
And
gosh.
And that's huge because I'm one of those not necessarily empathic people, but I'm the fix it person. I want to get it better. I want to fix it. So I found myself just doing the whole like letting it pass through me. I am a like a vector for you to heal, but I'm not going to take your stuff with me. And that was so huge that I think that's how I'm going to be able to practice for a lot longer. I was getting nervous. I would be done practicing by the time I was, well, 4 years from now.
Oh my gosh.
To me,
I'm
that was an unrecognized goal because I didn't even know it was a goal.
Wow, that is huge. Oh, that makes me so happy. Wow. So, Melissa, how about you? What was your hope in signing up for this course?
Well, I guess it was kind of twofold because in the knowing piece, because I can remember like my husband asked me, so what is this about? And I remember saying, I'm not 100% sure, but I think that the focus is going to be on me and there's something I need to know and learn. And because I knew that there was going to be a lot of the things that we were learning to do with our clients for us to do with ourselves. And so I had already I had gone through perimenopause and I was on this whole journey to figure out how I can be not go in the nursing home and not, be awful in my middle age and not have to give up my clinic practice and all that stuff. And so it was really perfect timing, knowing that I can explore these things within myself and then, recognizing them in clients, like the number of times that I would start a session with you at like just reading the video, doing the videos or reading the books. And I'd be like, I just can't imagine, like I couldn't think of anyone in my clinic that this would apply to. And then someone walks in. Like I'll tell you the ovaries, I can't wait till we have our meeting to talk about it, but that's one of the examples. It didn't resonate with me when we did it. And then when I had my call with my buddy, she's like, all right, let's just sit and do it. And I was like, there it is. And I was able to explore it and it made so much sense. And like a client that I'd been seeing for a long time, she'd gone on vacation, came back, and she's like, I'm no different. I was no different before. I'm no different today. And I just didn't know where to go. And so then she turns to me and she goes, yeah, I had surgery on my ovaries when I was 5. And the number of things from this class that just Rolodexed through my mind. And I thought, oh, and I had to like center myself in the seat because I was sitting there going, I don't know I didn't have any idea what to do. And then when she said that, there were so many things, thinking about the trauma of this 5-year-old having this surgery. She's had no children, but she has these 2 little scars and it was really interesting because learning to keep my mouth shut, Lori, that's like a really hard thing too. Like I really wanted to pull all this out. And all I know is she sat on the table as I was doing some treatments with her with my hands. I was checking out her scars. We were just kind of doing some things and talking. She was very quiet. She said a few things. And then I just saw these tears. And she just said, I have so many thoughts. And I haven't seen her again. But the sense at the end was like, she came to this realization that this has something to do with everything that she's experiencing today, but she hasn't visited that in so long. And if she would have come into my clinic before I started this course, I would have had no clue. I would have been like, well, we could do some scar release, but I would have had no clue what to talk to her about or what might be going through the rest of her system to know how to help this excruciating cramping that she's getting in her abdominal area. So one thing I learned is never put something aside and think, oh, no one's ever gonna, that's not gonna work for anybody, because they'll walk into your office the next day. Oh, okay.
Well, I don't
So,
I don't know if you guys experience this in your, experience in being in this program, but for me, when I was doing my work years back, I'd go have a counseling session, and whatever I healed would show up on my table the next 4 clients. And it was just like, it's amazing how quickly they show up. And, I love that you were able to get together with your study buddy. That's one of the parts of the program is you guys have a partner that you go through the program with and you practice on. And had you not done that yourself and had that
Right.
experience yourself, you wouldn't have been available to support her in the way that she needed it. Oh my gosh.
Yeah, I would have come home and gone back through the video and like, what did she say? And so I wouldn't have been able to have that like foundation
Yeah,
conversation because she and I had had no conversations about trauma or emotional releases. We had none of those conversations. It was pretty straightforward physical therapy, physical stuff. But it was very obvious that this was really loud inside of her without her having paid attention to it and not making any connection. Um, so
did
we'll see.
she feel any different after that session? Do you remember?
She didn't, so she wasn't having excruciating pain like it comes and goes, but she was definitely feeling emotional when I mean, there was definitely like, oh, and we were, we talked about a lot of things. So
Yeah,
I'm really curious to talk with her again because
yeah,
to see what kind of things came up for her after she left.
right. Awesome. Wow. Thank you for sharing that. That's really cool.
Yeah,
Really
yeah.
cool. Nancy, how about you? What were your hopes in taking this course, this program?
Uh, my hope was that I would find and become a part of a like-minded group of practitioners.
Yeah, I remember that. I remember doing your call at the beginning. Um,
And it's been a long search and a longing for community.
did you find it?
Yes, absolutely.
Awesome. 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 Oh, that's
Yeah,
so good.
I'm gonna speak. I think I can speak for Lori and Melissa, and if I can't, you can correct me. But I think all of us, I feel like I could reach out to anybody in the group if I needed to. It was like something came up, something's come up. Can you help? I could put a message in the group and say, hey, anybody got 5 minutes to talk or 10 minutes to talk, and somebody would reach out. So I just feel like there's so much mutual support.
Yeah.
Um,
Yeah.
from anybody. And again, the study buddy, we have a great relationship. We're gonna room together when we come out and to Colorado. So it's just great.
Awesome. Oh my gosh, that's great. And we need that support, don't we?
Yeah.
W- With the kind of work that we're doing and I really feel that we as a pelvic health PT doing the intravaginal work, working in this space, it's like getting thrown into the deep end of the ocean and not knowing how to swim with what can come up from the body and the emotions and the trauma and you're like we all need these skills to be able to better support our clients and I'm so grateful to each and every one of you guys for showing up so fully. Oh my gosh, our group calls, I am just blown away. Every time we get together, we meet once a month and do group calls and everybody gets to practice. We're in triads and everybody gets to practice on you're a therapist, you're the patient or client, and then there's an observer. And we rotate through in the 3 hours that we're together, and everybody gets support and worked on. And that's why I think, you've created that bond of really supporting each other throughout these 9 months. And that support doesn't stop when the program ends. So that it's a beautiful, beautiful bond you guys have created. I love that.
I wanted to
Yes. Yeah,
say
Melissa.
something when Lori, when you said you don't worry about them at night, I want to, that's something I'm hoping to come to. I have noticed that I do still have that worry. I can manage it, but I still always think, oh my gosh, how is that person doing? But I can say that I feel like more often I'm they're okay. I mean, more often than not, and I have worried for nothing. So yeah, that
Well, I think we're
that's something
able
I
to,
need to learn more.
we're
to
able
let
to,
that go.
like, we're able to leave the sessions in a different way than we left them before. So we didn't just leave them with exercises and these stretches will help you, these breathing exercises will help you. We're leaving them with, you're going to be okay because your body can heal. We're putting different home exercises into their brains, and we're giving them different tools and strategies that are incorporated of their nervous system, their emotions, all those pieces that that's the glue to our bodies, is holding together, not just the bones and the muscles and the tendons. It's the electricity, it's the energy, I can say that word now. I used to be afraid to say energy, but now I say we have body energy. And that was a big stretch for me, because I didn't want people to think I was a crazy person, not doing physical therapy. But I'm like, well, it's electrical. It's like energy. And so I've been able to say that word without feeling like a crazy person.
Oh, that's awesome. That's awesome. It's a huge part of who we are, everybody. And oh my gosh, I can't wait to share when we get together in November. Everybody in the program is coming out to Colorado to my house, and we're doing a 2-day live um, retreat and getting to practice on each other. And there's some new energetic techniques that I really am excited to share with you all, so that we can play around and get to feel that on each other again. So that's going to be super, super fun. I'm curious, did any of you guys have any hesitations or concerns about signing up that you did when you were signing up, like, and how did you overcome them? Anybody? I'll let you jump out there.
I think my hesitation was, am I going to be able to stick with it?
Mm,
And big life things happen all of the time.
right.
And am I going to be able to keep up with the work, and keep up with life?
Mhm.
And so I think that was my biggest concern.
Yeah.
And or would I lose steam in the middle?
Yeah. What did you notice, Nancy?
Well, big life things happened,
Hmm.
and um and priorities had to shift,
Hmm.
and then you just get back on the saddle. And again, because everybody is supportive of where we are in the moment, my study buddy and I just rolled with it. We both had some life challenges come up, and so we just rolled with it. And we would send text messages to each other, just, hey, everything okay? And um
Hmm.
so I do think it's it's been easy to stay committed, and at the same time it's been hard to stay committed. So I think that there's always this paradox for me, and it's like it's both and. Um and it's been totally worth it.
Okay. Cool. Thank you for sharing that. Either of you guys, do you have any concerns or?
I think my hesitation also was, 9 months of something. That's, again, not a patient person, kind of antsy. But then I came to realize that, well, I didn't learn the patience part till about May. So I have to say, it took me a
We
couple months,
started in February, everybody. So
a few months. But then I realized that, oh, this is my morning routine. So I get up, I have my coffee, I have my Lynn time is what I call it. And I watch videos and I watch summits and I watch whatever's going on at that time. I watch the lectures, and it just kind of grounds me. It settles me. It gets me in the frame to do my work. And it just became a habit to me to check in with the course, check in with the work, and then go back and, watch other things that I had maybe missed or hadn't gotten to yet. So for me, it was just building it into my daily routine. That's how I kind of overcame that hesitation. And I have to say, it was a little bit of a hesitation because it's a more monetary commitment than I had paid before. But I did the math, and if you do a 9-month course, it's going to be at least 9 weekends of work. So that's probably about the same if you think about it, weekend for weekend. And it was something I hadn't learned before. And if you're a clinician for many, 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 many years, you can take the same courses over and over again. It's just the same stuff replayed. This was new. This was building in the nervous system with the tissues, with the emotions. And that's not anything I've ever done before. So it became so much more fascinating. And the hesitation was like well, there was no, the concern was gone because it was so worth it. Because I read like the body keeps a score. I'm like, okay, well, that's great. How do you do that? And I would read books about trauma and read books about caring for people, but it was never put together. So it immediately became obvious that it was the right thing to do after getting into it.
Awesome. Cool. Melissa, do you have any concerns or hesitations?
Well, yeah, I think just like anybody, the time and the money commitment, if I just looked at that piece, that was kind of big, wondering. But I knew that I was supposed to. And so being able to break up the payments was very helpful to do it that way. And also it became something I really looked forward to because I was always finding nuggets to use in the clinic. And so in that sense, it doesn't get old. It's not like you're learning. I mean, the fact that you have changed the program into, I can't imagine doing this in, what was it, a 4-day weekend?
It was,
Because
yeah.
it's really nice to go, okay, now I have this. I mean, the timing, even though it's 9 months, I feel like the timing is very doable and very easy to, okay, I learned this. And now in walks this person who had ovary surgery at 5. I mean, it's just like you can practice for a while and then we meet and we can talk about what we saw, or you meet with your study buddy. So even though that time seemed like it was going to be a lot, I'm always taking courses and listening to podcasts and reading and doing those things anyway. Always looking for those little nuggets I can use in the clinic. And so this is just what that became for me in this time frame. So yeah, they were, and also, you wonder, is it going to be worth it? Is it really going to be? I mean, I took weekend courses from Lynn and they were great, but 9 months, I don't know about that.
Can I put up with her that long?
Can I do that for that long? But it really just solidified it just goes so nicely with all the other information that I learned, as well as all the other things I know from being a PT for 30 years. And again, putting the name to stuff I've already known and kind of was already doing, but didn't really know that I was already doing. And so, yeah.
Yeah, that's awesome. What surprised you the most about the program? Anyone?
The
Were
way
there
it changed
differences?
the way it changed everything about how I practice,
Oh,
really.
really?
Like I would either sit the night before or the day of, and I'd be looking at all the clients, or even on the weekend, and I would have like this prepared thing. Okay, this is what I did last time, and this is probably what I'll do this time, and maybe I'll do this. And like all this time spent, or the worry that I will have no idea what to do. And now someone will come in, I'll be like, gosh, I haven't seen this person in like over a month. I'm not worried at all. I just know I'm going to sit and I'm going to listen and I'm going to follow wherever it goes. And when I do have a plan, it almost is never what I want to do and how I approach the patients, right? So their buy-in and their healing is so much better because not only did I tune in to my intuition, but I'm also working really hard on them tuning into theirs. And one of the things I tell them is that whole line about yes, I have expertise and I know all your muscles and bones. It's all fabulous stuff. But my job is to help your body heal, and your body's going to tell us what it needs. I'm not going to tell you. And I make sure they know you never grin and bear it. If I am touching you in a way that doesn't feel right, and it doesn't even have to be painful, because sometimes it's kind of painful, but they're like, oh yeah, that's good though. Like that's an intuition. So if I'm doing something and you're like, no, that doesn't feel, I don't like that. You tell me, you will never offend me. You can kick me out of the room. And that is and I have been kicked out of the room. And that's a very different approach than I've ever had before. Like, and I don't even know that I wanted that, but it was like, well, I'm the PT and you're the client. This is what you need to do to get better. And if you don't want to do it, I guess you won't get better. And I mean, I wasn't that flippant, obviously.
Right.
but it is so cool it takes the pressure off me almost. Like, I don't need to know what I'm going to do with you today because you and your body are going to tell me.
Oh.
And that might sound really crazy, but it
Mhm.
totally works.
It works.
It does. So that's a surprise.
Okay. Yeah. That's
And
totally
I
done.
I'm going in to see 6 people today, and I have no idea what I'm doing with anyone, and it doesn't matter
It doesn't matter.
because I do know once I'm told, and however I'm told. And I
Yeah.
always ask everyone too, is there something that you are sitting here hoping happens today, hoping Melissa does this or that or whatever? And sometimes they don't, but when you see them for a while, then they're like, yes. Then they start to, and even when you're touching them and you're asking them for feedback, and at first sometimes they're like, I have no idea. And then they start, you
Mhm.
know, then they start tuning in. Oh yeah, it does feel, and knowing that they can say something that sounds funky. Like, I don't know, you're touching me over here on the right side, but I feel it in my left big toe. That's okay.
Right.
I might not know why, but that's exactly what's happening. And it may give us information for where we're going next. So many things surprised me really. But that
That's great. Thank you. Thank you for sharing.
mhm.
Lori or Nancy, did you guys have any surprises?
My biggest surprise is that I thought I knew what it meant to be in my body
Um,
until I took until in the first month. I think even Lynn, I reached out to you and I was like, oh my gosh, I'm not in my body yet. I know everything, but I'm not in my body. What's my pelvis? What do you mean? And so then as I started to become more in tune in what was going on in my body, what the women who were showing up were women who were like me, who thought they knew what were going on in their body. And then they were really thinking about it, and they could talk about their feelings, and they could talk about all of this stuff. And I kept saying, yeah, but what's the sensation? Is it? And I would go to the sensing words, and I would just be with them as they were getting frustrated, like, well, I'm telling you. And I'm like, no, that's what you're thinking about it. Where are you experiencing it in your body? And so again, the people show up, you're learning it, and then you see it in everybody else. And so it's just fascinating to me that I thought I knew.
mhm.
I thought I was doing more, and I was more in tune with my own body. And I was just like, oh no, I was so clueless in some parts that it's been very funny for me to think about that. And then just notice like, okay, well, wow,
Yeah.
that's pretty amazing. And so if I am not, and I thought I was, how many women are walking around and they really don't know? And I've latched on to your um one thing that I hear you say is that until we can feel it in our body, we can't heal it. Until you can feel it and whatever that sensation is in the body, we can't heal it. And that, again, some of the stuff that I had been holding on to with the birth trauma and all the other traumas in my life, just being able to sense it in a different way, um, and be supported around that.
Mhm.
It has also just watching women, again, the empowerment that women have once they are able to feel safe in their body, the healing is amazing.
Yes. Yes, it can. How does it feel, or what do you notice difference about being embodied more now?
Um, um, I can be quiet in the clinic,
Mm.
and family and friends just tell me that I feel more centered. I feel more stable.
Mm.
Um, and again, things that have been happening um, in other parts of my life where in the past I would have just been spinning out of control. But how I like to describe it now is that I am the eye of the hurricane, and I can be very stable and grounded, and things are spinning around. And I was like, oh, what? Right now it's Monday, and I've got these 6 people, so I'm going to pull those 6 people out of the hurricane. I'm going to work with them, but I can stay completely grounded and everything else. And I can let go of things that I can't control of at that time.
Nice.
Mhm.
Wow. That sounds huge.
Yeah. I also think it's allowed me to, again, being more grounded has allowed me to be able to be more present. And I don't have, because I, when I do put my hands on somebody, I can pretty much, like, they'll say something right after I've gotten whatever's happened, right? And I don't have to say it anymore. I'm just very quiet. And so instead of being the narrator of their story, I'm allowing them to narrate their story.
Wow. And what does that do for your results? Like how has that impacted your outcome?
I um I think what's happened this year is that women who have been seeing me for a while, because I treat a lot of women with persistent pain. So sometimes they come in once a month, sometimes they come in once a quarter, sometimes they come in every other week. They've noticed a difference. So even my clients, the people that I've followed for a long time have noticed that. And I'll just, because they know I'm taking the course, I'm very open, like, hey, I'm learning this stuff. And so um, they find it fascinating, like they love some of the new things that I'm able to bring in. But the women that didn't know me before, and I'm just starting with them and they're fresh. I think they take more ownership faster in their healing.
Nice.
And I hear less and less, you did this for me.
Uh,
And it's more like thank you for helping me get to this point. And it's the language, thank you for helping me get to this point, but not thank you for getting me to this point.
wow.
And
That's
so I think that's been a huge, huge shift. And again, I think able for me to be in the eye of the hurricane.
yeah. And that's so important because if we're in that swirl out there, we can't help our clients who are swirling as well. There's
Right.
we have to be that calm. We have to have that therapeutic presence in our own being so that we can be that grounded, centered, healed place so that we can help someone else come to that as well.
Right.
And that's awesome. And so, Nancy, I'm curious because as PTs, we are taught to help someone to do something to someone to make someone better. So was that weird for you to have, to let go of that?
Yeah, yes.
Let's be honest here,
Let's
'cause
be
we
honest.
all like.
Well, I think we all want to be good at what we do, right?
Yeah, yeah,
And we want people to get better, because why else would we do what we're doing, right? And
right.
so, but again, for me, it's the change. This class, this course, this 9 months, my whole way of being feels like it is just expanding. And things that I thought were true about myself, like I truly thought I knew what it was like to be in my body until the first month of the course. And
Mhm.
but instead of being upset about it, I just got really curious about it. And people who know me would think, oh my, I would have gone into this shame. Oh my gosh, how can I have been a PT for this long and not being able to experience this in my body? Oh my gosh, something's really wrong with me. And I was just, because of the support and because of the way the material was presented, just be curious. And so I was just like, oh my gosh, how could I have been this? And people came to me, and people come to me because they've heard I'm really good, right?
Yeah.
And so I was doing something right.
Yes.
And so I was just really curious, well, how can I not be in this part of my body? Like, what do you mean? And so again, just being curious about it, and then just being really curious with somebody else when they come in with a question like, well, what do you think is going on? Like, well, why did this happen, Nancy? I'm like, well, I don't know. There's could be a lot of reasons. What are you thinking about it? Like, what do you think happened? And they will tell you.
Right.
Right? If we're
Mhm.
and they were telling me because I would say, "What did you think would happen?" And they would tell me, and then I would put my hands on them, and I would do my manual work, and I'd be like, "Yep, that's exactly what happened." But I think I take so much less credit for it because I'm not narrating their story.
Mm,
I'm a
Yeah.
so I I always let women tell their stories because I think we've not been heard for so long. But this is just I think this I thought I was empowering women before, right? Because I was helping them feel better, but I think this and I don't want to take away that for the women that didn't get the better part, because I think this is a better part of me, right? So I don't want to take away that the work that they did for that part, but I am just much I just get out of the way much more quickly.
yeah.
And when people like women who are coming in and sometimes they're really stuck and they sometimes we have to help them. Sometimes what's been I think we all sometimes see if anybody could just do this one thing, everything would be so much better for them. And we can't make that judgment anymore for anybody else. I can't make that judgment for anybody anymore because I don't know, maybe they could do that one thing and maybe things would be better, but maybe things would not be better for
Yeah.
them. And so I think for me, that's been the biggest aha for me and getting out of the way, but also being really curious about myself.
Awesome.
And I came into this not thinking I was going to learn so much about myself because I thought I was already so embodied. And so I was just going to come, it was going to be like the icing on the cake. And I'm like, oh no, we like that cake got thrown out and a whole new batter is being made. I mean, it's just now starting to get baked. Like, forget the icing. Maybe we're still mixing in ingredients. I don't know, but the old cake it's gone.
Oh my gosh. I think the funniest thing, or not funniest, but the most interesting thing about that is you were doing good work before.
Yeah. I mean, I'm gonna be humble and say, yes, yes, I was. But now
Yes.
I'm doing, I don't know if it's better. It's just different. And I think it's empowering more people.
Nice. Nice, nice, nice. I love hearing that. Cool. Thanks, Nancy. Lori, any surprises for you?
I am surprised that how well this applies to everybody. So
Mm,
I treat all kinds of people. So I have men, I have post-surgical, I have bowel, bladder, pain, SI, back, hip, everything pain. And this works for everything. And it even works with neuro patients. So the because I've always been trying to put this into words to explain to my regular PT people what my course is all about. So I think what I've come up with is it's a way to integrate proprioception, interoception, and exteroception using the nervous system channeling to feel your body and make your tissues work differently.
wow.
So I wanted to be a neurotherapist when I first got out of school. So I did a lot of work with stroke rehabs and on the mats and helping people walk. And so that was my I love the neuro part. I love the brain. I love the,
Wow.
cerebellum connections to the homunculuses and all that. So to me, this is like waking up the sensory cortex to put it into the motor plan so these people can do things differently. Not just doing the exercises and doing the stretches, but feeling the movements,
Mm,
allowing your body to do the movements that you want to do because you're processing that information differently. And we use our hands, we use our stories, we use our emotions to help drive those movement patterns. And that's the fascinating part.
yeah.
If that makes sense. From
I love it. I love it. It truly is. It's a combination of the interoception, exteroception, and proprioception in our body. And I loved how you said that. That's so beautifully put, and being able to combine it all. And, I love saying that the body is telling a story and it's our job to read it.
Exactly.
And so do you guys feel much more prepared and know that you have the skills now to read the story of the bodies in front of you?
But I have a specific
Definitely.
example, if you want a specific example.
Cool, please share.
I had a Parkinson's woman, and Parkinson's patient. She came in with bladder urgency. She was having to wear diapers, and that's why she went to the pelvic clinic. So she came in, and she was sitting in the lobby. Her husband was standing in front of her. She couldn't get up. He had to hold her to pull her up because she didn't have that any kind of forward momentum to get out of the chair. So she did her like small shuffling steps, forward bent truck walking into my clinic. She sat down, and her eyes were like this, like wide eyes, very stiff. She could barely dissociate anything, just wide eyes. I'm like wide-eyed back to her. I'm like, okay, no. Let's ask questions. What's going on? My bladder is so urgent. I pee all over this myself. I leak all the time. I can't sleep. I can't do anything. I'm just upregulated nervous system. So long story short, I just said, okay, well, we got to talk to your bladder. I said, we got to breathe. I want you to sit in the chair. I want you to close your eyes. And I had her start to feel her body. I said, have you ever felt your body before? Because she's been to PT, she's been stretching and doing all her exercises. I said, well, just sit here, close your eyes, feel your ears, just that body scanning kind of idea. I said, feel your bladder. I said, what's your bladder saying? It wants to go pee. I said, well, does it really? So I started asking the bladder all these questions and gotten curious, got her to proprioceptively, interoceptively, whatever septively, get into her body. And then I said, okay, now that you've stopped, you've felt, now let's try to move. So she was able to start rocking back and forth and dissociating because she wasn't watching where she was going. She wasn't afraid. She started feeling her body differently. She started to rock forward, and I said, can you stand up? And she just popped right up off the chair. And she stood up really straight, and her eyes relaxed. And then she walked around the room because she was feeling her body versus just trying to move. It was fantastic. And then she sat back down. She says, my bladder doesn't have to pee anymore. And I said, well, that's pretty cool. So we came up with a little mantra, stop, feel, then move. Stop, feel, move, stop, feel, move. Don't just move. Don't just go. Stop, feel, move. And that got her to transfer on the bed by herself. And she was able to roll up to stand because she wasn't just going with her sympathetic dominant system. She was able to dissociate and rotate and feel. And it was fantastic. And then she didn't have to come back because I helped her. Her husband was like, you're standing up straight. And she goes, I got up by myself. I both cried. I was in tears because she was just so happy. And she, come to find out, her limiting belief and her trauma was this Parkinson's was taking over her life. And that was her, she said, this Parkinson's has taken over my life. I said, is it? So we talked about how to shift that and how she could shift her movements if she just maybe tried it a different way or did some other proprioceptive movement pattern that triggered different neuroreceptors in her body, or some neuro term that my friend Amanda would use. But but that was beautiful because she was able to really take in like 1 hour session to stop, feel, move, and it just made a tremendous difference. So I felt empowered.
Wow. Lori, that is incredible.
It was
What
I
a
was,
story.
and then with men, I treat men. So I was guiding this guy. He has chronic testicle pain, chronic penile pain. So I started to think about, okay, well, that's kind of like the ovaries and the uterus. The prostate's kind of like the uterus, this little junction, all the little cords come in there, and this wrapped around with nerves, and it's just this little bundle. And the testicles come down like little mini ovaries on the outside. So I was like, okay, well, let's get them to talk to each other. So, so I said, okay, let's do your body scan, go down, into your body. I said, you know what? All these tests and things you've had, no one ever talks about your prostate having any problems. Your bladder has IC and blah, 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 blah diagnosis. And your urethra is on fire all the time. You can't pee. You have to hold your testicles because they hurt all the time. So I said, let's just talk to the prostate. That's a happy organ. No one said that one's broken. So we came to this visual about being like a plum with no skin. And it's got this slippery, slidey, glidey movement. And I said, let that plum just expand into your pelvis and let the warm I had to guide him through because he didn't, I had to help him with the imaging rather than him coming it to him by himself.
Yeah.
But again, long story short, he was able to feel his pelvis in a way that actually had, blood flow and motion and warmth and energy, and his pain was kind of in half by the time he left because he was about an 8 out of 10.
Wow.
The idea of just using the proprioception and the interoception to help someone feel their body differently so they have a different response is what I really learned. And then how to, tie the emotions in and how that creates the holding patterns. And then you can build that also to the next levels. So those are some examples of being a regular PT and what you would see, and then how this energy work, emotional release, stuck energy can just affect so many different ways.
Wow. Those are cool. Those are cool. Nancy or Melissa, do you guys have any other cool stories you want to share? And then we got to wrap this up. It's getting long. But I know this is so fun for me. I want to talk to you guys forever. But any fun cases that you guys can think of how this program has really impacted your clinic and your
Well, I can think of one young woman that I'm continuing to work with. I started seeing her right right after the course was, I think I started seeing her in March.
okay.
And she had urinary retention after she delivered, and they'd put a cath in. She had been complaining that she couldn't pee, and they finally cathed her after the baby was born. And the baby was born during COVID, and so they wanted to get her out of the hospital. So they took the catheter out. She had some droplet pee, which they said, okay, well, you've peed, so they discharged her home. She went back into the ER. They had to call the ambulance. She went back into the ER. She told me that they took out over 2 liters of urine. Now, I haven't seen the report.
Yeah.
So that's not confirmed, but when they did the bladder scan, apparently the nurse she said her eyes were like bugged out and she was horrified. So she had months of urinary retention and she was self-cathing. She had a lot of childhood trauma, parents controlling when and when she couldn't go to the bathroom. So she came to me and she'd already seen 3 other pelvic PTs. She'd been to somebody in New York and had Botox injections. She'd even had herself worked up for MS because she thought something neurologically was wrong.
Wow.
And she said that she saw me on Instagram, but I'm thinking I haven't been on Instagram for over a year. I don't know. So anyway, she found me somehow.
Right.
And she came in to see me, and she was just so upregulated and so all over the map. And so I had her do a pelvic bowl scan just to see, like, can we get you into your pelvis? Can we find any sensation? And she could do that, but she started to get triggered. And so then for her, I just said, is there one place in your body where you feel safe? Because there was just so much stuff. And so from there, we just expanded where she could go. So now, so from her too, she's been great and really embracing getting in touch with her body. And she actually just sent me an email about how important this work has been for her, and that she feels the best that she's ever felt, and that she's like this, for her, this was true healing.
Wow.
But there was the things that we had to work through with from her parents, because her grandmother lived 3 hours away. They would make her pee before she left, even if she didn't have to, and then she would have to hold it for 3 hours because they said, we're not going to stop for 3 hours.
Oh my gosh.
There was just there's just kind of trauma on top of trauma. And then than this whole birth, yeah. So
Yeah,
she's had a lot, and she's done great, and she's done a lot of really good work.
that's great. Oh, wow. Don't you find that birth, the trauma that occurs in birth, just replays previous traumas that have been
Mhm.
held in the body? And
Yeah.
so I feel like it's just so important if we can help these moms, ideally before they get pregnant, to release those traumas so that they don't have to replay them or reiterate them in that birth process.
Right.
Yeah, yeah, cool.
I know we're running out of time, but I have one story
Awesome.
too that I
Yeah,
wanted to
I
share.
gotta hear it. Go ahead.
So this story is really cool because I live in a smallish town, and there's one OBGYN office um, that does babies in the hospital. And I've been trying for 3 years to get in that office to talk to them and haven't been able to. And so I'm kind of just taking even my business, like if I build it, they will come, and I'm not going to chase, and they do. But I had this gal come in. I've seen her, I think, 3 times. So she came in and she has had excruciating abdominal pain, which she describes as, I think my ovaries are just about to burst. But she's been to therapy, she's been to different doctors. There are no cysts on her ovaries. They can't find anything.
Mhm.
So this one doctor referred her to one of the OBGYNs and said, go do a hysterectomy consult. So she goes in, and this doctor, whom I've met one time, says to her, and I'm still like just amazed about this. Nope, this is musculoskeletal, and you have to go see Melissa. She doesn't take insurance, but she's the one you have to go see. And there's a therapy office attached to our hospital that, like, they always just refer to their own. But she mentioned me by name and said, and I'm like, really? Like, I was shocked because I've had clients that she was the doc, and so there must be, that word going
Talking
back.
about
And
it. Oh,
so, nope, it's musculoskeletal, and you have to see Melissa. And I was like, wow. So I won't tell you her whole story because it's long, but she had 3 babies, 3 cesareans, no scar tissue work, and very traumatic. Like the first one was a really long labor that turned into a cesarean. The second one, she was not here in Durango, but she was on the table ready for her cesarean. She had gone into labor, and a stabbing wound came in, and they said, we'll be right back. An hour later, they came back. And so the other thing that's kind of cool about this person is she's a psychotherapist. And for some reason, Lynn, I have had so many psychotherapists come in since I've started your class. I'm like, this is weird. And it's been really cool because they kind of are confirming. Like, I had one tell me, wow, you're really trauma informed, because I don't change anything. I've stopped doing that because sometimes, when you're younger and you're like, oh, I've got to do it the way. Nope, this is who I am. This is how I do it. And if I'm not for you, that is okay with me. I'm not changing it because I think you might think I'm weird. And that's one of the surprises, I think, for me too. But so I've seen her 3 times, and she, for the first time in 10 years, has had some relief. And she's like, I can't wait to go back and see this OB who saved me from having a hysterectomy, in which she would have been. Can you just imagine what her life would be like now? Oh,
yeah.
so I'm just so grateful for that. And so the other thing I always talk to them about is that emotional release. I'm like, you may feel it. It's okay. We will work through it together. I kind of have this whole spiel. And she's like, okay. So after the first session, she came back and she told me she cried for 2 days, and her husband redid all of their births together. And she said, she's one of those people that was telling me all about her births with a smile on her face. And inside I'm going, yeah, no,
That's not
that is,
congruent.
it's not. There was a whole, so when she came back and told me that, I'm like, oh my gosh. And she said it was the first time really since her third birth, which was, I think he's 12 now, maybe less. Anyway, it's been about 10 years. And that she's had this pain. And she's like, I've never really done that. And I think that's my other thing is like in this world of gaslighting, it is so refreshing that we can do it different. And that in and of itself makes those women respond so differently. I'm helping her with her musculoskeletal, physical ailments, but like Lori said, incorporating it with that whole. And one of the things she said to me is, I am so happy to know for the first time in 10 years that my insides are not about to explode. That was what she kept thinking. It's all just gonna explode one day and I'm gonna die.
That was everything that was being bottled up inside of her.
Besides a C-section scar that was cut open 3 times and no one ever mentioned that she should massage it, ever. And she never touched it because it's all sensitive, and now she's like rubbing on her belly and rubbing on her. I'm like, yeah, rub away, girl, rub away. Just like I do.
Gosh.
You do the
Wow.
same thing.
Oh,
So
that is amazing. I too find that a lot of psychotherapists come into our practice and my practice as well. And
really,
it's so fascinating for them. They love it. They
Mhm.
love the body-mind connection, that we cannot process it just from the mind. And I don't feel we can process it just from the body. We really have to merge the two and do body-mind together. And I say body mind because the body can't lie, and that's what should lead the mind. And that's what we learn, or you learn in the Birth Healing Intensive program, is how to listen to the body and feel for the shifts and changes in the tissues and the energy, in the quality of what is between your hands, because that guides you of whether you're going down the right path or not. And our mind can take us down 10 different paths, and none of those may be correct. But the body helps you to know when you are on that right path. And that's what helps make the biggest releases in the body. So it really is body mind together gets the greatest healing. So oh my gosh, you guys, this has been incredible. Thank you so much. I am so lit up inside. I don't know if you guys can see it if you're watching this on video, but I am like beaming just hearing how much this program has impacted your lives and your practice. And most importantly, your patients, your clients that you're seeing, and how much better results you're able to get. And Lori, a Parkinson's person, that was incredible. Oh my goodness. I love it. I love it. Love it. You guys are the best. Thank you so much for being here and sharing your experience with us. And I am so, so incredibly grateful to each and every one of you, and to all the students who have joined me in this Birth Healing Intensive program this year. It's just been incredible to watch you guys just grow and blossom and apply this work out into the world, and make such amazing impact with your clients. So thank you all so much for being here. Thank you everybody for listening in. And here is to smoother births, faster recoveries, greater healing, and we'll see you all in the next episode. Take care, everybody. Bye-bye. Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.